This is Dr. Bill Wyatt, and thank you for watching now. And we're going to go into the third video today on Class 3 correction by using the method that we take out the lower 6-year molars, and that'll bring the lower teeth back, and we also pull them back further sometimes by using Class 3 elastics, and that gives you a little more room up above for your tongue. And we have, so far, I've not had any of these Class 3 corrections that we've done by removing the 6-year molars that have relapsed. And it's just simple retention of the Class 3 problem. So let's get started. We're going to show several of these cases, and this is number 3 in this list that we'll be showing you. And the severity, we're going to do some real young ones, and I'll do some older ones also in here. But you can look at the teeth on both of these cases. This is a Class 3. You can look at, see how the teeth are over here, and then check them on the way out. This is the finished case over on this side over here, and we'll go through that each time. Now here we're seeing the Class 3 problem. You see the lower teeth are crowded and they're way out here, and we've got the 6-year molar. The bottom is too far forward over here, so we're going to remove it. But we don't need all of this space right here. So we're going to pull these teeth back to their class. They'll fit up in here, something like that. And then we'll bring the other teeth forward. If we need to, we'll sometimes bring these back some with Class 3 elastics, and that brings the teeth to the front and gives you a little bit more tongue room in there as you bring these underneath here. And we can close these. This is a young man who's older, and we've got his wisdom teeth already in right here, so there won't be a problem for that. Now we're trying several new things, and now when I touch the screen up here, it'll have a deal that'll draw your attention to that point right there. And let's watch this, how it goes. Thank you for tuning in. I'm going to show the x-rays in a line like we've done before. This is the thing when we started off, and he's age 19, he's almost 20, see. And we're going to take out the 6-year molars, and we're going to start sliding these forward, and we'll carry these to a Class 1 somewhere along it. Well, it'll be about along there, and we'll bring that, and then we bring these back to that point too. And sometimes we may pull this back by pulling these teeth forward here and bringing these back. That works pretty good. And this works out really quite well, and we've had really good results with this, and of not having to redo any of these Class 3 cases, and that's a mouthful, really. We're able to do that, and in many of the cases, in this case, the guy had the wisdom teeth, so we sacrificed them, and you look down, your wisdom tooth will catch right in here. Sometimes we have them develop put a crown on and catch this tooth just at the back, right back in there, same way over on this side right here. And to me, this is a thing that ought to be done everywhere. I mean, there's so much Class 3 correction done. And the cases that we've done on this, you can go study them, you can look them over, and you look at them 10 years, 20 years, 30 years after you've done this. And if you just take care of them and keep them in a mild retention for a little while when you start, we've had no real problem with that. And so let's go on and see the other parts here. Now, these cases, a lot of them brought about, and I think in showing you this is a little distorted over here, bringing this in further than it should be. This is the way the upper was to start off with in 1987, and this was 1989, but we've got a little reflection in the mirror there that probably brought that side in. Now down on the bottom you can see we've kind of increased the flow of this, and we got room enough for all these teeth down here. We're bringing the cuspids back. Now if you back up the cuspids and the other teeth, you need to have the tilt in them, or they tend to come back to the place they were in. So we hope it works like that. Now here again is the finished thing. This is 1989, and we've got the teeth underneath and looking like in pretty good shape. Here we'll pull this back, and we're pulling this tooth forward. So we're backing these teeth up, and that takes a little bit of the room, but as we pull these forward from the back, we don't have to bring these in the anterior lower. We don't have to back them up that far, so we keep extra room in here for the tongue to fit in, and that holds it steady. And some of these bad class 3s where we've done surgery and you had to bring the lower jaw back. If you didn't do a double jaw surgery, you bring these back and you crowd the tongue, and after you get through, the tongue pushes the other teeth forward in there. So they have a tendency to relapse, whereas these don't have quite that tendency to do that. But we've not had a single one of them relapse on us since we've started this. So here are the finished cases, and it doesn't look all that much different before and after, but his teeth are, you can see the crowding we've got on the teeth, and we'll be nice and straight over on this side. I thank you for watching, and we're going to look at several more class 3s next time when we go over this. So thanks for tuning in, and we'll try to more or less prove that it is good to do this type of class 3 correction. And I thank you for watching. Now we're going to close out. Bye-bye.